Hi there. About 20 years ago when I started as a chiropractor, we used to talk about disc problems and how they affected old people. And a disc problem in most situations comes from one of two causes. Either it's through some form of acute injury, so you lift something heavy or an accident or something similar, or it's cumulative stress and strain over a long time. That ultimately leads to the symptoms of a typical disc problem. Now the odd thing is, and perhaps sad thing is, nowadays, instead of disc problems happening in a higher age group, we're starting to see disc problems in really young people, teenagers sometimes, certainly into the 20s, and also with degenerative changes. Now there's got to be a question of why is that happening and where does it come from? And really importantly, if a doctor tells you you have a disc problem, what are you going to do about it? Hi, I'm Craig Osborne. I'm a chiropractor here in the Chiropractic Lounge in Lindau, and I wanted to share my knowledge about disc problems to help you with looking after yourself, and also if you are faced with this issue, I have a disc problem, what is important to do about it? So the first thing is to understand, well, what is a disc? And what we have in this plastic model here, this is a lumbar spine area. And so we have the vertebra itself, so this is looking from above. So this would be the bits you can feel at your spine, and this is inside you. And the disc would sit right above this area here. So when we look to the side, you can see how the discs create cushioning between each of the vertebrae. And then right behind the disc, this yellow section here is indicating the spinal nerves. So when we have all of these, part of the role of the disc is to provide shock absorption. And over time, because of pressure and weight and effort, the fluid inside these discs starts to dry out. And when that happens, obviously it starts to get thinner, and sometimes, and oddly enough, the most sensitive part of the disc happens to be right about here, exactly where the nerve exits. So sometimes this rips or gets a small tear in it, and when that happens, this liquid from inside the disc can ooze out and start pressing on the nerve. In the lumbar spine, we talk about sciatica, but it can also happen in the cervical spine with similar symptoms into their arm. Importantly, perhaps to know, is that this liquid in the middle is a little bit like the consistency of toothpaste. So it's not going to just flow like water, but it has a degree of malleability that we can work with sometimes in terms of treating these type of conditions. Now, what type of symptoms are you going to get? Nerves are quite sensitive, and when you push them, you tend to get a very sharp stabbing electrical type pain. You can also get pins and needles affecting certain areas of your body. If you look that up, it's called a dermatome. And if the pressure is sufficient, as I'm sure most of you have noticed, if you sleep on your arm at night and falls asleep, so you can start to lose function to whatever it is that that nerve is supplying. Now that is considerably important if that means that you're losing muscle control, if it means you're losing organ control. And I'll come back to that issue in a moment. It means then that when you have symptoms that indicate a disc problem, there are different types of pain you can also have. I mentioned the sharp shooting, stabbing electric type pain, but you can also get pain in a similar body part if the joints of your spine at the same level aren't moving particularly well. However, the pain tends to be a little bit different. It tends to be a little bit more of a dull pain, although it can be intense, and you don't tend to lose function. But you can still get pins and needles occasionally. So let's say you go to the doctor with what you think is a disc problem, and they look to diagnose you, and there's two things that are necessary. Two things to properly diagnose it. The first thing is your symptoms and what you have. And depending on where it is, there's different ways it can be tested. There's the reflex tests, which you know, like with the knee, and they should be normal, or obviously if you've got a disc problem, not. And the other thing that is usually done is not an X-ray, because an X-ray won't show you the discs. It will either be a CT or an MRT. Now with those two things together, you go, right, the photo matches with the symptoms, we have a disc problem. Unfortunately, what is often done is based purely on what you say, without tests being done, you're sent off for a picture, and the picture is used to make a diagnosis. The issue is, especially with low back conditions or spinal conditions, and only about 4% of the time is the problem actually related to the disc problem. You might have a disc problem at the same time, but not the cause of your symptoms. And this is why I believe a lot of people are diagnosed with a disc problem, but that isn't the issue, and then have a recommendation of perhaps, okay, you need an operation. And the question is, well, if they say that, what is the prognosis? What's the possibility that getting an operation is going to be useful for you? Now, there is widely accepted, as I understand it, a fairly obvious point where you say there is no choice, and that's when organs stop to function correctly. There's something called Cauda Equina syndrome, where you have problems with bowel and bladder control, and that's basically an emergency. There's no question, head off there, but it hardly ever happens. There's also things where you start to lose muscle control or complete sensation, and there has to be a point where you go, this doesn't work anymore, I need to look at an operation to take the pressure off the nerve. Otherwise, that sensory loss or functional loss can be permanent, which is not great, especially if it's affecting an organ. The thing about having an operation, though, is it tends to give you fast relief if it's successful in that regard. On the other side, however, there's also quite a lot of research that says that disc problems are hugely unsuccessful. One research paper I looked at said that low back disc operations are only 1% effective. And that another research that compared an operation against conservative treatment, for example, chiropractic, that after a 2-year period, the patients were at exactly the same point. So, just to repeat, you get a fast increase with the disc and with the operation for the disc, and then it flattens off. With the conservative treatment, it can take a little bit longer, but you can get to the same point, assuming that both types of treatment are effective for you. So, no treatment is going to be 100%. You can't guarantee it's going to be 100% effective. That doesn't exist. And there are times when an operation is essential. However, I believe it needs to be matched to the symptoms, and that the symptoms need to be sufficiently extreme enough that it does not make sense to continue. I see a lot of patients who have had recommendations to have an operation where they haven't reached that stage. And I know that in my practice here, over the 20 years, I've helped lots of people not have to have an operation through a conservative approach, which is what chiropractic is in that regard, because we look to try and minimize your need for medical intervention, whether that's medication or an operation. As I mentioned earlier, when we look at the cause of disc problems, it's typically either an acute thing, which we can't change, an accident, an injury, or we're looking at cumulative stress and strain, and that's primarily through physical overexertion, okay? Or a simple movement repeatedly done, repeatedly repeated, so it's like a micro trauma. If we can look to restore function, we can look to restore the natural neurological and muscle control and stability of that part of your body. If we can restore the posture so that your spine is carrying your weight correctly, that also decreases the stress and strain. And even if it gets to a point when operation is useful, I would always say as soon as possible. Once the healing process of the soft tissue is sufficient, then we need to look at getting chiropractic into your lifestyle so that we can get your back strong again. Because otherwise the chance is that it might just come again. And that, of course, is symptomatically not fun and doesn't do anything for your quality of life. At the end of the day, a disc problem is very common nowadays. It's very common to find someone with a disc problem if you take enough MRTs or MRIs. However, that doesn't mean that that's the cause of the person's symptoms. And quite often just the symptoms that people talk about, I have butt pain, and because it's intense, they say I have sciatica. And it's not always the case. So if chiropractic sounds like an interesting thing for you, then I'm here for you at the Chiropractic Lounge in Lindau. There is a lot of information on my website on chiroloungelindau.de. There's an English page there with everything in it. And if you're interested in making an appointment with me, of course, you can always do so using the online appointment page. I hope you found this interesting. Feel free to spread this video. It might help someone who is struggling with their own disc problem right now. All right, have a great day. See you soon. Bye-bye.